Let's start with a small question. What did you eat for breakfast today? Feel free to use the chat box, or if you'd like, you can unmute yourself and answer. Okay, Gayatri's had dosa, and there's toast, bread and butter, puri, dalia, milk, locho, besan chila. Shefali's had bread and egg. Somebody's had Maggie. There's idli, poha, paneer. Very good. Thank you, everybody, for answering this. Oh, Soul has skipped the whole breakfast. All right. Idli with sambar and chutney. Oh, nothing as yet, Ria. All right. Next slide, please, Lisa. While we were eating our breakfast, did we ponder about the fact that what we ate might actually impact how we feel today, all day, or even maybe for the week that's coming along? No, right? That is what we are here to discuss today. First, let's do a brief introduction on how nutrition and mental health are related to each other. Thank you, Lisa. All right. So, a simple understanding is the gut brain axis. Our gut isn't just a digestive organ, it's a bustling hub of activity with millions of neurons communicating directly with your brain. You know how sometimes we are like, when we are feeling very anxious, our gut starts to act up. And sometimes before a big presentation or before a first date, there's butterflies in it. It's just our gut sending signals to our brain. So, that is how we can assess that there is a gut brain axis. The mood food connection. Ever noticed how certain foods can instantly lift our spirits while others leave you feeling sluggish and irritable? Sometimes a good dosa can make for a really good day, and sometimes a sad dalia can maybe make us feel not so good and maybe drowsy. That's because what we eat can directly impact our mood and emotional well being. Foods which are rich in complex carbohydrates like whole grains and vegetables promote the production of serotonin, the feel good neurotransmitter. Meanwhile, indulging in sugary treats may give you a temporary, also lead to mood crashes and irritability. Not exactly the recipe for happiness. Next is the nutrients for nerve health. Let's talk about our brain's favorite vitamins. The B complex vitamin, particularly vitamin B12, what we are going to discuss today about. These nutrients are like the maintenance crew of our nervous system, ensuring smooth communication between brain cells and supporting cognitive function. Low levels of vitamin B12 have been linked to several mental disorders, which we will discuss in particular later. So it's essential to include these foods in our diet to keep our brain humming along smoothly. Okay, some of the things we'll be looking today into are, next slide, please, Lisa. Right. So our first goal would be to understand B12. Our second would be how B12 impacts our mental health. Third would be identifying the mental health implications if B12 is deficient in us. Fourth is how do we assess and diagnose this in mental health settings. And fifth is the very intervention strategies that we may imply in order to keep our mental health healthy. Next slide, please, Lisa. Let's start with the basic understanding of B12. I'm sure if you guys have scrolled through Instagram enough, or if you have nutritionists on your feed, you have heard about B12 before as well. If you're somebody who gyms a lot and has protein, you have known the word cobalamin, which is also a name that is B12. It is a vital nutrient. It's water soluble, dissolved, and is not stored in large amounts in the body. Just a second, I think. Right. All right. There are several functions that B12 actually essentially starts off in our body. First, starting with the formation of red blood cells, it also synthesizes our DNA. It helps with the proper functioning of our nervous system. It synthesizes dopamine and serotonin. But what makes B12 particularly interesting, especially for our workshop today, is its crucial role in supporting mental health. It's involved in the synthesis of neurotransmitters, which are chemicals that transmit signals in our brain. Additionally, it plays a role in the production of myelin, a fatty substance that insulates our nerve fibers and is essential for proper nerve functioning. Next slide, please, Lisa.
Yes, Harshita is facing a network issue. We'll just begin in another 1 minute or two. Sorry for the inconvenience.
Right. Hi, everyone. So, by the time Hashita comes back, we can just talk about where we can find vitamin B12. So, as it's written on the slide, right, that we can mostly find it in animal products. So, basically things like beef, pork, lamb, even through eggs, chicken, turkey, fish, salmon, a lot of seafoods. We can also find it in a lot of dairy products like milk, cheese, yogurt, eggs, and particularly in the yolk of the egg. Can you all hear me now? I hope I'm audible. You guys can send a thumbs up.
Yes, you are audible. Yes, you are.
Great. Then another place where we can find it is in fortified foods. Now, fortified foods are foods that have had nutrients added to them that weren't originally present in the food or were present but in very low amounts. So, for example, in things like cereals or non dairy milk like soy or oat milk, or even curd, mainly because this is mainly in our vegetarian diet or even with vegans in nutritional yeast, right? In other sources, we have all the supplements. So, like vitamin B12 tablets, capsules, any tablets or sprays, vitamin B12 injections, which are administered by the healthcare provider, the doctors that we go to when we find out that we have some severe deficiencies or absorption issues, because of which we don't have B12, a lot of B12 content in the blood, right? I think Harshita is back. Are you back, Harshita?
Thank you so much, Shefali. I hope that I'm audible.
Yes, you are.
All right, perfect. Thank you so much for taking that in. All right, guys. So now that we know where we can source our B12 from, I understand that it does get a little bit difficult for, especially for vegetarians, right? Let's think about where we have been implicating these in our cultural values as well. Next slide, please, Lisa. Next slide, please. Right. Let's think about how every time we have an exam or there is an auspicious thing that's happening, maybe a new job, there's often a time that our grandparents or our parents feed us curd, right? Especially with sugar. Maybe we can ask ourselves this question that consuming curd before a significant event is perhaps not just practiced because of the cultural tradition, but also because of the nutritional science behind it. Curd is one of those things that includes quite a high amount of vitamin B12 and contributes to the benefits by supporting our energy levels, by improving our cognitive function, and also our mood, which are all advantages for facing an important task. How many of you guys have had curd before an important event? You can send in a thumbs up emoji or a clap emoji to let us know. All right? A lot of us then. That's great. Thank you so much for responding. Yes, Anisha, do you have something to say? Okay, all right. Thank you. All right, let's move on then. Um, Lisa, let's move on to the next slide, please. Okay, so let's discuss what we're actually here for, understanding B12 and its impact on our particular mental health. We're not going to get into too much of the science behind it, but just the basic premise of what happens and how it is implicated. Next slide, please. Right. Some of the most common disorders that are associated with B12 deficiency are psychosis, anxiety, depression, and cognitive impairment. Psychosis, studies have shown that the significant association between B12 deficiency and psychosis. Psychosis is often characterized by hallucinations and delusions. In simple terms or in layman terms, psychosis is considered as an alternate reality, right? Both acute onset and chronic psychosis, that is long term and short term psychosis, have been reported in individuals who have low levels of vitamin B12. Although there can be resolution of symptoms if you supplement B12, however, the exact mechanism of B12 deficiency leading to psychosis remains quite unknown. It is encouraging to note that in the cases of psychosis associated with this deficiency, there has been noticed good outcomes even after prolonged periods of time of psychosis with replacement of vitamin B12. Next is anxiety. Anxiety is something that we hear about all the time. This is something that we know about quite a lot at this point. Anxiety disorders have been implicated in this context as well. Research indicates that there is a correlation between low levels of vitamin B12 and heightened anxiety symptoms. Individuals with anxiety disorders often exhibit lower levels of vitamin B12, highlighting the potential role of this nutrient in modulating the anxiety related pathways in the brain. Recall how we just discussed that B12 helps in synthesizing the neurotransmitters. This is where it plays a part. When it comes to treatment, if an individual is taking conventional antidepressant therapy along with vitamin B12, it is seen to be quite beneficial. Next is depression. Depression, again, is something that we hear quite a lot about. It's a prevalent psychiatric disorder and has garnered attention in the context of B12 deficiency as well. Research suggests that because B12 helps with the synthesis of serotonin and dopamine, it is implicated in mood regulation. If there are reduced levels of vitamin B12, it has been observed that individuals with depression indicate a potential link between nutritional status and the depressive symptoms. Again, treatment is beneficial if taken with antidepressant therapy. Next are cognitive impairments. Cognitive impairments are essentially impairments in the process of thinking, believing, fact checking, memory, etc. Some of the common ones that especially is involved when it comes to B12 deficiency are dementia and delirium. Dementia is a lack of memory, especially included with age, and then there's delirium, where the individual is unable to comprehend. Both the role of vitamin B12 in both of these cognitive functionalities, particularly through its involvement in myelin sheath formation and neurotransmitter synthesis, underscores its importance in preserving cognitive health. Research suggests that individuals should actually take vitamin B12 irrespective of these issues in order to help with their cognitive functioning. Next slide, please. These are some other disorders that have been implicated when it comes to lack of vitamin B12, such as substance use disorder, dissociative disorder, schizophrenia, somatic symptom and related disorders, adjustment disorder, post-traumatic disorder, and obsessive compulsive disorder, which is also known as OCD. Yes, Pramila, did you have a question?
Sorry to interrupt. I want to know about the psychosis. Which could you please repeat that psychosis about the previous slide?
Right, definitely.
Thank you.
Lisa, can we move back to the previous slide, please? Thank you. Okay, so psychosis is essentially, like I mentioned, a alternate reality belief that we might start to have, right? Hallucinations and delusions are involved when it comes to psychosis. It can be both acute and chronic, and B12 is seen to be relevant in both these cases. When it comes to treatment, it is often seen that if the individual is taking psychotherapy along with pharmacotherapy and B12 supplements, it is beneficial. Was there a particular question you wanted to ask, Pramila?
No, ma'am. It's okay. Fine. I got the answer. Thank you.
All right, thank you so much for your question. Yes, Bhuvi, go ahead.
Ma'am, what supplements we can take for, I mean, B12 supplements?
Right, of course. Like Shefali just mentioned before, there are three ways in which you can take B12. First are animal products. So there's meat, where it's beef, pork, lamb. There's chicken, turkey. There's salmon and fishes like haddock or tuna. There's also dairy products like milk, cheese, yogurt, and especially eggs. And the egg yolks are quite beneficial when it comes to B12. There's also fortified foods. Fortified foods are essentially foods that have added B12 in them. So, if you've heard of the cereal Special K, it often involves an added function of B12 in it. Also, there's also the intervention therapy, like supplements like injections or capsules that you can take.
Ma'am, that's what I want to know. What type of capsules? I
Right.
mean, I've never heard about.
Mhm. Okay, so those questions will be answered later in the workshop when we talk about interventions. All right.
Okay, thank you.
All right. Uh, there's also a question from Sanjana. Right. What about vegetarian and people who don't eat dairy products? So one of the special things when it comes to vegan food is the cheese that they utilize, which is nutritional yeast, which is quite high in B12 as well. And then again, there are fortified foods in vegan food also that can also be utilized. When it comes to interventions, Lisa will mention that in a bit. All right. Okay. Let's move on to the next slide, please, Lisa. Right. So we've discussed the different disorders that may be implicated because of lack of B12. Let's move on and have like a fun element here in order to increase our awareness about B12. So let's play like a symptom bingo. All right. This is a list of items. Next slide, please, Lisa. That may be implicated when there is a deficiency in B12 in our bodies. I want all of us to go through these, and you can raise your hand and answer it for me, or you can type it on your chat box if you have felt symptoms like these before. There's fatigue, there's disturbed thinking, there's delusions, there's immobility. Yes, Bhuvi, go ahead.
So I had fatigue. I felt very lethargic
Mm-hmm.
mostly, and yes, I still have a fear. I have anxiety issues also,
Mm-hmm.
and yes.
Okay. Thank you so much for sharing, Bhuvi. Echolalia, Kashish, is the tendency to repeat what people are saying or re-repeating what you've already said. Repetition of multiple words or one word in particular again and again. That's echolalia. All right, Kanu has mentioned that she's felt all of these symptoms before. Anisha is doing the same. Vivek has mentioned the same. So has Kate. Right. These are some symptoms that are quite common, right? But however, they may come and go based on the intensity of it all as well. We can't say that all of these symptoms are because of deficiency of B12, but it may play an important part there, especially when it comes to confusion, memory issues, dizziness, numbness, low concentration, personality changes. When it becomes really intense, or if the implication is very, very high, there's a sense of fear that starts to build in. There's personality changes, which can be very difficult for individuals around us also to deal with. Okay. Any more answers, or can we move on? How personality changes, Kashish? What happens is because of the lack of B12 in our bodies, our mood starts to wane, right? Which leads to a lot of swinging of moods, which again can be implicated in loss of interest with individuals, feeling that you don't want to interact anymore. Social isolation can be a part. That is how it comes about. All right. Anushya mentions fear and anxiety. Pramila is also mentions fear. Right. Kay mentions, asks the question, what's the best B12 level to maintain? This will be discussed again with Shifali will be informing us about this. All right, let's move on to the next slide, please. We're now going to move on to a bit more research-oriented content. We have Shifali who's going to help us understand that. Over to you, Shifali.
Hi, Ashita. Thank you so much. Right. So, as Ashita has talked about, we've realized that mainly we find vitamin B12 in animal derived products, right? Like meat, eggs, and also dairy products. But it is not that readily available, or it's available in very low amounts in plant derived products. So that is exactly why, because in developing countries or developed countries, actually, we have a lot of improved nutrition in terms of like the food that we have, the intake, the quality of the food products and everything, right? So vitamin B12 deficiency is a little bit rare, but it is still prevalent in a lot of the developing countries, which India also comes under. Mainly because in India, a lot of sections of society, we have a pure vegetarian diet, right? Now, the reason why we wanted to include this section is because it's very important to understand what sort of psychiatric manifestations can occur in terms of vitamin B12 deficiency. So, I think it has been mentioned before by Hashita that things like depression, irritability, dementia, delirium, or even hallucinations can can be included when we talk about the psychiatric manifestations, right? So can we go to the next slide, please? Right. Now, this is a research study basically where they realized that there were about 19 patients in the research study who had a lot of different psychiatric symptoms. There were patients with characteristics of schizophrenia. So they had auditory hallucinations, they had thought alienation, which means that they felt that their thoughts were completely alien to them. There were delusions of persecution. They thought that, that other people are pointing towards them, or that somebody is out to get them. Then there were some characteristics of depression, mainly a lot of depression cognitions like anhedonia. So they were losing interest in the things that they felt um, pleasurable before. So maybe a lot of their hobbies. Then being easily fatigued, and a lot of somatic symptoms like maybe headaches, backaches, shoulder aches, right? And then there were characteristics of bipolar disorder. So there were a lot of classic manic symptoms. So being extremely elevated, talking a lot, maybe talking over other people, having a very fast stream of thoughts, so fast that you cannot keep up with it when you're talking to somebody about them, right? Also being very irritable, that is also another thing that came under the psychiatric symptoms. Now what they realized is that all of these patients who had all these psychiatric symptoms, when they further evaluated them on any deficiencies, they realized that all of them have a coexistent vitamin B12 deficiency. And this was initially suspected because most of these patients had a vegetarian diet. So 14 of the 19 of them had a strict vegetarian diet, and the rest of them had very limited diet when it came to non-vegetarian diets, right? And that is, as we saw, is because we don't find vitamin B12 that readily available in plant products, right? Now, Harshita has also mentioned in the chat box that vitamin B12 is found more in non-vegetarian diet like lamb, chicken, turkey, and in dairy products as well. Yes, Bhuvi.
Ma'am, Harshita ma'am shared that in curd we can B12 vitamin is there, and so now you are saying that we that in vegetarian diet we can't have B12.
Right. So I'm saying that it is more readily available and in higher amounts in non-vegetarian diets and animal-derived products. Now, curd again is an animal-derived product, right? Because it comes under dairy. In strictly vegetarian or even vegan diets or plant-derived products, B12 is available, but in very low amounts, right? So, where people sustain themselves only through plant-derived products, for example, vegans maybe, they have a higher chance of developing a worse B12 deficiency, right? That is what I meant. Is that clear?
Yes, ma'am. And
Great.
you were saying that people who have racing thoughts and they speak
Mhm.
very fast with anyone, or if if a particular person is oversharing something and they are just feeling lonely. So is it also a psychiatrist? It's all also comes under psychiatrist uh,
Psychiatric
treatment.
symptoms. Right. So the thing about these symptoms is that it is not, isolate. I'm not isolating these specific symptoms, right? I'm talking about these when it specifically comes to bipolar disorder. So for any symptom or any psychiatric symptom to be called psychiatric or a disorder, for it to come under disorder, it would have to be very severe and very extreme, right? So when you talk about specifically people who are maybe only lonely, then in that case it might not be applicable to those.
Okay, thank you so much.
Great. All right. Can we go to the next slide? Lisa, can we go to the next slide, please? Yeah. Okay, so now talking about the normal levels of B12. Normally it is from 174 to 878 picograms per milliliter. Now, pg per ml is a unit of measurement that they use in medical tests. So basically, one picogram is like 1 trillionth of a gram, and we know that 1 milliliter is 1,000th of a liter, right? Now, coming to this specific research that we talked about just before this slide, most of the patients, some patients, had their B12 levels in the lower limits of the normal range. So basically, this is sort of like evidence for a previous finding that said that these psychiatric symptoms like depression or irritability, they can actually predate the neurological symptoms like dementia or hallucination. So these are the more serious symptoms, and they can predate them by as much as a few years, right? So basically what this says is that even having your B12 in the lower levels of this range, and if you see that you start to have any symptoms like depression, irritability, or similar symptoms, it is really important to get the B12 checked and also have a better intervention for them, because they can these symptoms, if you keep them unchecked, they can lead to more severe neurological symptoms like dementia or hallucination, right? Now, in this specific research, they also found that psychiatric manifestations can occur before the levels of vitamin B12 are below 175 pg per ml, right? So even when they are in the lower range of this range, the normal range, it can lead to a lot of psychiatric manifestations. Although there have been some studies that are right now researching this thing called as a window period. So this window period basically is a period in which the treatment that you have to reverse your B12 deficiency can lead to a lot of good changes for you, and this is sort of being researched very heavily right now. So this is like a main thing that is being researched in terms of B12, vitamin B12 deficiency research. Yes, Pramila.
Yeah, I want to ask a question. So, if anyone gets the time of going to sleep, if you get any type of hallucination like those various sets of colors and all, and not able to sleep and all those things, what does that mean?
Right. So this is, it sounds like something that could be, the result of a lot of different things, right? Because it is a very wide question, I feel.
Uh-huh.
So if there are, if this is specifically, is this about specifically about you? Can I ask?
No, no, it's that my daughter is there. She's having this type of hallucination thing, and so he can't sleep, and she's having headache and all. And she's while sleeping, she's getting all those colors and all in her eyes, and so many. Matlab, she's unable to go to sleep. So these all things which is it is coming in her eyes and all. The headache is happening and all. So I want to ask about this. Yeah.
Okay, so in this case, since this is something that is more personal, right? It would not be possible for me to answer this here,
No, no,
because
I
you would
want to ask,
require.
is it the deficiency because of the deficiency of B12, or is it the deficiency of vitamin D? Because she's maybe she's going to sun means she's getting little bit okay, but even though she's having the same type of feeling at the time of sleeping, and headache is little bit lower, even though now she can't sleep little bit like this, having the same type of pictures in her eyes while sleeping. Yeah.
So to sort of conclude anything, whether it is because of a B12 deficiency or a vitamin D deficiency or anything else either,
Mm-hmm.
we would require a lot of, firstly, more. So I would personally require you to tell me more about this. We would have to have a personal session so that I can
Okay.
inquire and ask you a lot of different questions about it. And
Okay.
also, understanding if you have a B12 deficiency would also need a diagnostic test, right? Which we'll
Okay.
talk about.
Okay. She has to take a B12 test, right?
Yes, so you would have
Yeah.
to
Yeah.
take a B12 or vitamin D test or a blood test in general, or have a personal session with the counselor.
Yeah. Yeah. She took the test of vitamin this one vitamin D. It is very low, and vitamin B12 she might have not taken. I will inquire about it.
Right,
Yeah. Yeah.
right.
Okay,
Okay, okay. Thank you for that.
thank you. Yes, Bhuvi.
Ma'am, could you please repeat what you said uh, that this is very important to get checked. Can you please
Right.
repeat that sentence? What would be?
Yeah, sure. Yeah, before that, as Kay said, let's do one thing. Let's take all of the questions at the end. Of course, if you guys want me to repeat anything or go slower or explain something a little bit more, then you can just drop it in the chat box as well, right? Yeah, so Bhuvi, to answer your question, right? The main important finding from this research basically was that they realized that even in the normal range, which is 174 to 878 picograms per milliliter, even in this range, a lot of the patients, some patients, had their B12 levels in the lower limits of this normal range. And what resulted was the psychiatric manifestations. So things like depression or irritability, right? And they, in another different research, they have realized that this is sort of like in the lower limits of this normal range, you'll get the psychiatric manifestations if you leave these symptoms unchecked. So let's say if you don't improve your B12 levels, you don't work on these things, and you just leave them as it is, they can develop into more severe symptoms like neurological symptoms, which would be like dementia or delirium, hallucinations, things like that, right? So that is what I was talking about. All right, let's go to the next slide. Right. Now, how can mental health practitioners help assess your B12? Sorry. Right. So before that, actually, since we've talked about what the normal range is like, and we've also talked about how being in the lower limits can give you a lot of psychiatric manifestations already, right? So then, what is like an average or adequate level? So a lot of research suggests that having a level above 600 picograms per milliliter is advisable, right? So your vitamin B12 test should be somewhere around 600 or above. Right now, how can mental health practitioners help you assess your B12? Next slide. Now, mental health settings, obviously, we cannot give out blood tests to the clients, right? You would have to go to a physician for that. But before that, to even realize that you might have a B12 deficiency, your mental health professional would help you assess a lot of different types of symptoms. So, firstly, they might look at any physical symptoms that you have, like pallor or jaundice. So, pallor is mainly about your face being more stiff, right? So pallor, jaundice, fatigue, weakness, if there's any physical numbness in you or you feel like there's some tingling in your arms, something like that, right? Then there is assessment of dietary intake. They would look at what your diet is like. If your diet is mainly vegetarian, if you're a vegan, if there are any gastrointestinal disorders that make you restrict your diet, like maybe restricting dairy products, right? Then also if you've had any previous surgeries that involve your stomach or intestines, right, that could also lead to a lot of changes in your diet. Then they look at neuropsychiatric symptoms. So any mood changes. This is where things like depression or anxiety or the manic symptoms that I mentioned before, those come in. Any cognitive concerns. So maybe if you are forgetting things a lot more recently, if you are not able to remember things in your memory, if you're not able to remember maybe what your day was like yesterday. Now, if I immediately ask somebody, okay, what did you do yesterday? It's not that you would always have an immediate answer, right? So that's not what I mean by not being able to remember. I mean in a more serious way that even if you try really hard to remember, you cannot remember. Even if a friend reminds you, okay, we met yesterday and then we talked about these things, and you're like, oh, yeah, I remember that we met, but I really can't remember if we talked about this, right? So these sort of difficulties in memories. And then psychosis. And Harshita has also previously mentioned in detail about psychosis, right? Symptoms of hallucination or delusions, similar to schizophrenia, right?
So these are all the symptoms that your mental health professional would start to assess first. And if they realize that there's a pattern in these things, they would definitely recommend you to take a blood test or a B12 test. Right? Next slide. Now, this is where the mind body collaboration is very important. So, this is basically the collaboration between mental health practitioners and medical professionals and nutritionists. Right now, as I said, your mental health professional is going to sort of realize a lot of different things in your thoughts, your emotions, and your behaviors. So, there's a thing called as brain fog. So, this is like not being able to think clearly, not being able to concentrate on things or focus on things. There's a lot of confusion, forgetfulness, paranoia, even. Then, when it comes to emotions, there could be symptoms of depression, symptoms of anxiety, irritability, and it reflects in your behaviors, right? So you could be really fatigued. There could be sleep and appetite disturbances. So maybe you're sleeping too much, or you're not able to sleep at all, or you sleep but you don't, you're not feeling fresh when you wake up. Similar thing with appetite, like maybe you're eating too much, or maybe your appetite is just like, it decreased by a lot, you don't feel like eating a lot, right? So understanding these symptoms and then immediately asking you to seek help from a medical professional or a physician is really important, the part of your mental health practitioner, right? Because the medical professional is going to check your physiological processes. So they will take a deeper inquiry into your gastrointestinal problems or any digestive issues, then biochemistry, which will be more about any deficiencies, any disturbances in your neurotransmitters, or any physical illnesses as well. As I mentioned, because if you've had any surgeries before, or if you've had any physical illnesses, that makes you more susceptible to these kind of things, right? Next slide. Now, the blood test. To understand if you really have a vitamin B12 deficiency, of course, a blood test is very, very important, right? Because before we get a blood test, all we can do is just maybe say or assume that, okay, there's a possible vitamin B12 deficiency, but we don't know for sure, right? Things could be caused by a lot of other things as well, right? So, to be sure about all of these things, it's important to get a blood test. So, now let's see how we can read a blood test. Can we go to the next slide? Right. Now, so when we talk about vitamin B12, I think Harshita has also mentioned before that there are different names for vitamin B12 tests, right? So cobalamin test, or cyanocobalamin test, or methylcobalamin test. These are all different names for vitamin B12 test. Of course, it's more commonly known as a vitamin B12 test, and you can get it at any of your blood test clinics, or even if you go to your general physician, your family doctor, they can also recommend you to go to any specific clinics for this blood test, right? Now, this vitamin B12 test is going to detect the levels of vitamin B12 in your body. That is because vitamin B12 is a water soluble vitamin, right? So it gets absorbed by your blood cells and nerve cells. Now, if vitamin B12 is not present in your blood cells and nerve cells, then your blood cells would stop functioning normally, and a lot of the times you'll also suffer from anemia. So your physician might tell you that, okay, you also have like anemic symptoms, right? Then your nerve cells might also work a bit abnormally, which is why it translates into this nervous system related symptoms, right? Like tingling in your hands or feet, or numbness, or confusion, or brain fog. Now, in this specific test, you see that the result is 181 pg per ml, right? So, does anyone remember the normal range? Do you guys remember it? Can you guys tell if this is good, if it's bad?
175, 175,
Right.
174 or something. Yeah.
Right, 175 was the lower threshold, and clearly 181 is on the lower limits of this range, which means that the person likely has a vitamin B12 deficiency, right? So it's really important now to take some precautions on this, right? Now, before we go on to the precautions, and before I hand it over to Lisa, a few things that are really important for you to know about taking the test is that it does not require you to prepare anything from your end, right? Only overnight fasting is required. So basically, you have your dinner maybe at 9, and after that, you don't eat anything. Drinking water is fine. That's cool. You can also talk to your physician and ask them if like you're needed to prepare for anything. But apart from that, nothing else is required. It's also really important to let the people who are coming to take a blood test or your physician know if you are on any medications that might affect your vitamin B12 levels, right? So you can maybe find that out if your medication has any side effects, right? Other than that, there are no restrictions. Even after your blood is taken, you can go back to your normal activity. You can eat your normal food and drink a lot of water, right? All right, let's move on to the next slide. Now we'll look into the intervention strategies. Now, how do you get your vitamin B12 levels up again? Lisa?
Good afternoon, everybody. Thank you, Shifali. Thank you, Harshita, for introducing a B12 and how it affects us. Now, let's go to the last part of our workshop where we talk about intervention strategies, limitations, and how to cope up with them. Right? So, uh, when we talk about intervention, we have to take into consideration that first is the B12 supplements. So, B12 supplements can be administered orally or intramuscular, which plays a very crucial role in correcting deficiency and elevating associate symptoms, which Harshita and Shifali has mentioned earlier. Right? So, oral supplementation is often the preferred initial approach as it is convenient, cost effective, and non invasiveness. For individuals with mild to moderate deficiency or those who can adequately absorb B12 through the gastrointestinal tract, oral supplementation can be highly effective. It typically involves daily or weekly dose of cinocobalamin or methylocobalamin tablets, lozonzi, or liquid formulation. However, in cases of severe deficiency, malabsorption issues, or conditions that impair gastrointestinal absorption, intramuscular supplementation can be necessary. Intramuscular injections bypasses the TACT, delivering B12 directly into the bloodstream and ensuring rapid absorption. This route is particularly advantageous for individuals who have difficulty absorbing B12 orally or who requires the higher doses to replenish depleted stores quickly. The choices between oral and intramuscular supplementation depends on several factors, which is very important for all of us to understand, which includes the severity of the deficiency, the presence of underlying medical conditions. It's not for everybody, so you have to make sure that you go to your doctors and ask if that is suitable for you, right? Individual preferences also takes into consideration and response to the treatment. Healthcare providers typically assess these factors to determine the most appropriate route and dosage for each patient. Regardless of administration of route, regular monitoring of B12 levels and clinical response is essential to ensure a better outcome and adjust treatment as needed. With appropriate supplements, individual can experience improvement in symptoms related to B12 deficiency such as fatigue, fitness, cognitive impairment, mood disturbance, leading to enhanced overall well-being and quality of life. This is one of the way. Second is psychotherapy, right? So psychotherapy includes cognitive behavioral therapy, where they show the efficiency in treating various mental health conditions into depression and anxiety, right? It focuses on identifying changing negative thought patterns and behaviors, promoting to problem solving skills and enhancing coping strategies. A lot of times, Richard Fali has also introduced to us and even Harshita that mood disturbance, irritableness, negative thinking, all the thoughts that comes into us because of the low bodily responses. This therapy would also help you to reframe your thoughts, restructure your thoughts in a way that you can cope up with your uh, thought processes. Second is interpersonal therapy. It is another evidence-based psychotherapy that targets interpersonal issues and relationships. It helps individuals improve communication skills, resolve conflicts, build social support. It also addresses mental health concerns associated with B12 deficiencies, like anxiety, interpersonal conflicts with your partners, interpersonal issues, issues with your own self. Everything that associates with your mental health can be solved here, along with the prescriptions that you might be taking forward or with the dietary plans, because it's not like our mind and our body work separately, they work in sync. So when we are taking supplements, it is also important for us to take care of our mental well-being, right? So other than that, what we can do is there are mindful based interventions. So when we talk about mindful based interventions, why is it required? To reduce stress by helping individuals focus on the present moment, accept their thoughts and feelings without judgment, right? High stress can exacerbate symptoms of B12 deficiency. So managing stress through mindfulness may indirectly support overall well-being in individuals. Then there is elevating anxiety and depression. Mindfulness practice have demonstrated efficacy in reducing symptoms of anxiety and depressions, right? Reducing their severity can contribute to improved psychological functioning and quality of life. Then there is yoga. Why yoga is useful? It is stress reduction again. Combination of physical postures, breathing techniques, and meditation promotes relaxation and reduces stress levels. Chronic stress can impair immune functions and exacerbate symptoms associated with B12 deficiency. So reducing stress through yoga may support overall health. Yoga is not just physical exercise, but it is also highly with your breathing exercise. Again, yoga can be a part of mindfulness where you are being present in the moment, you're meditating, right? You're being with your own self, right? Yoga will also help in anxiety management since there is a breathing that comes into the controlled breathing. Mindfulness can help individual manage symptoms. Then there is depression relief, where yoga has shown effectively reduce symptoms of depression, right? By practicing yoga, they may contribute to mood improvement, even enhance their overall mental processes, right? Then, other than that, what we can take into consideration is dietary assessment and education. Again, it is very important for us to understand that healthy diet is very important. Consuming a balanced, rich diet in B12 containing foods such as meat, fish, eggs, dairy, or fortified foods can help address B12 deficiency. A nutritious diet supports overall health, including brain functioning and mental well-being. Right? Also important to consider lifestyle changes, right? You cannot have a poor lifestyle, a sedentary lifestyle where we just sit all day, sleep all day, eat all the junk in the world, and then react as if we have done nothing, that we are going through a B12 deficiency, right? There is certain lifestyle changes that we do need to take into consideration along with your therapy, along with your food, along with your supplements, right? Because everything works hand in hand. It's not like you are going to take supplement and everything is going to be better. No, there are certain steps that you will have to take. So when we talk about lifestyle changes, regular exercise, it's very important. Physical activity is linked to improve mood and cognitive functions, potentially mitigating symptoms associated with B12. Again, healthy diet, sufficient sleep, right? In males, we need 8 hours of sleep. With females, you need at least 9 to 10 hours of sleep, which is very essential because adequate sleep will make sure that you have a good cognitive functioning, memory, concentration, right? Reduces the impact of B12 deficiency, stress management. Chronics can impair immune functions and exacerbate the deficiency. So stress management such as mindfulness, relaxation, social support, right? Where you are among your close and dear ones, where you can be around them, be loved around, be cared around. It's also very important for us to take into consideration. Then there are medicines also. Apart from the injections of B12 supplements, there are certain pharmacotherapy, especially anxiolytics, can be prescribed to elevate significant anxiety symptoms in individuals with B12. Antidepressants, anxiety is for depression and anxiety. It is taken into consideration that all these pharmacotherapy, that is the medicine, is to be prescribed by the psychiatrist under the guidance of your physician who has consulted you for the medicine. You cannot just simply go and take it from the medical shop or any pharmacy. It is not uh, legal to take it without any prescription. Make sure that you take all these medicines under the prescription, because antidepressants help in improving depressive symptoms, mood functioning. Anxiety also relieves considers when individual experience a heightened level of anxious thoughts, feelings, right? So make sure that you take all these medicines under prescription. Without prescription, it can backfire also. So let's go with a quiz. Very quiz for all that we have seen, right? So give me the answer in the chat box. True or false? B12 deficiency can contribute to symptoms such as fatigue, depression, and memory problems. True, true, true. Yes, it's true. B12 deficiency can actually contribute to symptoms such as fatigue, depression, and memory problems that we have done, right? Okay. So from all the illustrations, can you spot which one is B12 imposter? Which food in this image is least likely to be a good source of vitamin D? Of the food. Gummy bears, yes. Gummy bears is the right option. No, salmon is very good. Salmon is good. Salmon is good. Least likely to be good. Gummy bears are not good. So all of you have answered salmon. Salmon is actually good for your B12. Gummy bears are the ones which are not good. Okay. Which group of individual is at a higher risk of vitamin 12 deficiency? The right answer is older adults. Older adults are on the high risk of having a B12 deficiency. So it is to be taken into consideration that they have to, from the very start, we have to take care of our well-being from the start so that during our old later stages of our life, we don't face certain deficiency. Okay. So here, tell me which activity is most likely to hinder in your B12 absorption. First one is exercise, second is sufficient sleep, third is smoking, and fourth is eating healthy diet. Smoking. Yes, smoking will hinder a lot. Right answer. Okay. So this is a well-being plan, right? What we have to do is when we take care of our physical self, we also have to take with her, which also helps in a management of our mental health. It can be balanced diet, appropriate dosage in the form of B12 supplementation, sufficient sleep, which will also help in stress management, regular exercise, social support. We have to create a plan. This is a very template you can use for yourself and you can assess your own lifestyle or a well-being plan, right? Okay. So what are the potential challenges and consideration that we have to take into uh, account when we talk about B12, right? Okay. So what are the potential uh, challenges? First is limited absorption. Excessive B12 intake may not result in proportionate absorption by body. So what does it mean is vitamin B12 is absorbed in the small intestine with the help of protein called intrinsic factor, right? the body's ability to absorb B12 efficiently is limited, especially in high doses. So what we have to do is when intake exceeds, right, what body can absorb, the excess B12 is excreted in the urine. However, if excessively high levels are consumed, it may overwhelm the body's capacity to manage, potentially leading to toxicity, right? So, for example, Harshita takes a high dose of B12 supplement daily because she heard it boosts energy. However, her body only absorbs a small portion of it and rest is excreted. Despite taking high dose, Harshita doesn't experience additional benefit and might waste her money on excessive supplements. So it's very necessary when it comes to this. Okay. Second is health risk includes skin rashes, itching, nausea, diarrhea, and even neurological symptoms such as numbness and tingling. Over the counter B12 supplements are not always regulated for quality and potency, meaning the actual B12 content may vary from what's stated on the labels, right? This inconsistency can lead to unintentional overconsumption or underconsumption, increasing the risk of overdose and adverse side effects, right? So, for example, Shifali buys a cheap B12 supplement online without checking the brand's reputation. She ends up taking a supplement that contains much more B12 than labeled, leading to symptoms of overdose like skin rash and nausea. So, we have to be very careful when we take our B12 supplements. Unregulated supplements. Ingesting large doses from unregulated sources increase the risk of overdose and adverse effect. Excessive B12 intake can lead to various adverse health effects. Common symptoms of B12 overdose could be skin rash, itching, which we have already mentioned, right? So we have to take into consideration that irreg- irregular, unregulated sources should be not be taken for our health, right? Because it will harm us and it won't solve any issues. It will actually just add up to it more, right? So after reading about the benefits of B12, you have to decide whether to take high dose supplements daily or in the limited amount. It is also prescribed by the physician or your preferred doctor only. Do not take this into your own hands and treat yourself. It would actually lead to harming your body more. So always ask your physician before taking B12 supplements as well as the medicines that we have prescribed. Anything over or under will definitely harm you, right? So, what are the considerations that we can take into consideration? We can take into account. Individual needs, B12 needs vary depending on age, pregnancy, health, and genetics. Consult a doctor for personalized advice, right? Because these factors influence how much B12 an individual needs and how well they can absorb and utilize the vitamin. It's important to consult a healthcare provider to determine the appropriate B12 intake based on personal circumstances. Right. Second consideration that we have to do is safer alternative. Addressing the root cause of B12 deficiency through dietary change or addressing digestive issues that hinder absorption might be more suitable. So you have to choose any alternative which is safer and which is beneficial for you. It is crucial to inform healthcare providers or doctors about all supplements being taken to avoid harmful interactions and ensure safe and coordinated care. Right? Last is supplement interactions. Right? So what we have to take into consideration here is that high dose of B12 may interact with certain medications. Always inform your doctor about all supplements you take before starting a B12 regime because it can give you side effects. You cannot mix two medications that you might be taking for something else can hinder with your other B12 supplements, right? So you have to consult a doctor that you are already taking medicine for some XYZ thing, and you are planning to take it for something else. So you have to always consult your doctor. Do not, again, I would repeat 110 times, do not take B12 supplements without consulting a doctor. It will give you a bad reaction, right? So be very mindful when we talk about B12, because it is very crucial. Even from your start date till your later life, it will impact heavily on your body, right? So by addressing individual needs, being mindful of supplements, and considering safer alternative, individual can manage their B12 intake effectively and holistically, promoting long-term health and well-being. With this, we come to an end of our workshop. This is what we at MindTribe offer. We provide affordable counseling. There are free group therapies, and we have rich mental health resources. You can always go to our website and check it. With this, thank you.